All right, so get to sit here with my friend Brittney Cappiello, and I always say to know you is to love you, Britt. So I am so impressed with your passion and your knowledge in helping women. I've heard about you for years. I've known you now for a long time, but I've really just gotten to know you over the past year, and it's just like makes me wanna like throw you out into the world and like let as many women meet you as possible. So
thank you.
What is it that you do?
So I'm a pelvic floor specialist, and I've been treating women with pelvic floor issues for 17 plus years. And pelvic floor issues can be anything. Could be urinary incontinence, pelvic pain, vaginal prolapse, which is when your organs start to prolapse into the vaginal canal, urinary urgency, frequency, bowel issues. It's really a pretty general term that encompasses a lot of different diagnoses related to the pelvic area.
It's a lot of different stuff.
Yes, absolutely.
Uh-huh.
But all related to the same muscles. So while it seems kind of like all these things can be very different, they actually all stem from just the way that the body handles changes kind of in one region of the body, within the pelvis, within the hips. Okay.
And do you find that women who finally get to come see you, that how many other people have they seen or other approaches that they've tried? Are they hopeful?
Most of them have seen, research shows that they've seen an average of 6 to 7 practitioners before getting a referral to somebody that can actually help them.
Okay.
Most of them have very little hope of things improving. Most of them have already internet researched, tried different things that are out there because they were initially a little bit embarrassed to maybe tell their healthcare provider. I've had some women who have told their healthcare provider and been a little bit blown off. I've actually had women whose doctors have said to them, no, this is just because you've had a baby. This is normal part of aging.
I hear that all the time. I mean, I'm 45.
Yeah.
I have so many friends, so many women friends who just think it's normal.
Yeah, that's the problem. And it's that message gets relayed through the medical community as well, because I think that just the knowledge base out there, even within the medical community, isn't always great. And so these women are coming in really pretty anxious that they've even gotten there in the first place, but also feeling like they're just going to get another kind of story that it's nothing's going to help, that there's nothing out there.
So even if they have had the courage to tell their doctor or their friends, they're probably not getting really great advice.
No.
Okay. So what have you found that like gets women right off the bat to understand that there is hope? What do you tell them?
The first thing I start with women is the education. No one's even showed them a pelvis or the pelvic muscles or where the pelvic organs sit. And so they come in and I usually ask them, has your doctor shown you the model of and they're like, no, they have no idea. And when I explain to them that there's 10 different muscles that make up the pelvic floor, most of them are like, really? They just thought there was, a uterus and a bladder and, organs. They don't really think of a muscular component.
I like how you do the bowl.
It's a bowl.
Yeah.
Yeah, the pelvic bowl. So
let's talk about the pelvic floor, or what we now call the core floor. Floors create the bottoms of our homes, so it makes sense to use the term floor when describing this part of our body, as it is the bottom of our pelvic region. Unlike the floors in our homes, our core floor is made of 3 different layers of muscles and ligaments acting as the support network for all of your pelvic organs, including your bladder, uterus, colon, and rectum. Did you know there are actually 10 different muscle groups down there? Before we can train them properly, it's important to understand a little bit more about them. The first layer is superficial and is made of 3 different muscles. One of these muscles is responsible for helping to maintain erection during intercourse for both men and women. The second layer is comprised of 2 different sphincter muscles and supportive ligaments and soft tissue structures. The third layer is what most people are referencing when talking about that old school term, the pelvic floor. 5 different muscles make up this layer, and if you take a look at the muscles, they actually form what looks like a soup bowl. Each of these muscles have a slightly different responsibility. Some of them orient themselves in a more vertical position. This design helps to control forward and backward motions of the pelvis. Other muscles orient themselves in a more side-to-side position running. It is their job to help control the lateral movement patterns of the pelvis. The remaining musculature attaches from your pelvis to your tailbone and makes them work most effectively with rotational movements. The positioning and design of all this musculature allows them to quote unquote turn on like a switch with the movement of the hips, pelvis, and spine. Movement that turns on the muscles most effectively occurs in all three planes of motion: front, back, side to side, and rotation. If you have some difficulty moving in one of those planes because of tightness, weakness, pain, fear, or just general life habits, any of the core floor musculature can actually start to quote unquote turn off and become weaker, tighter, and potentially more painful. It becomes a terrible, vicious cycle. The core floor often gets blamed for many of the medical diagnoses impacting bladder, bowel health, or sexual function. In many cases, it is not the core floor's fault. It is easy to blame all of your symptoms on the weakness and tightness of these pelvic muscles, but it's just not fair. Remember, your core floor is completely influenced by everything going on around it. Every part of your body has a responsibility to perform a certain job. When jobs are not being performed optimally, other body parts will be affected and symptoms can be caused by other underlying problems. Treating symptoms without addressing the potential causes in other parts of the body might cause a little improvement, but with my core floor, I want to create positive, powerful, and long-lasting changes. I believe every woman deserves that level of success.
The pelvic muscles make a bowl that sits kind of at the base of the pelvic bone structure, and it's the support system for all of your internal organs. And I like to show women that the muscles have a different orientation. All of them run in different directions. And so if you actually look at the bowl, some of the muscles run actually more in a vertical orientation, some run in a more lateral orientation, and some actually run in a more horizontal orientation. Okay. And so because of that, it means that the pelvis has to move in different ways in order for those different parts of the muscles to activate. And so for a lot of women, they've lost motion in different directions, partially because of postural issues, long commutes, and a lot of sitting, less exercise and movement in general as adults, injuries, pain, things that will dictate their body's movement and what they do. And so when I can show a woman that and explain to them that this is why your pelvic floor is not doing what it should be doing. You're not moving in a way that stimulates those muscles to be strong enough to support your organs, to not have incontinence. You're not activating them enough to allow them to be relaxed, so that can cause pelvic pain.
So this is really we're meant to be able to control these things, right?
Absolutely.
So we both have kids. Yep. So we know babies are incontinent. Yes. So how do babies naturally become continent? It's not just because we tell them to. Yeah. So what are they doing and what can we do?
Right, exactly. It's their movement. So no one sits down with a baby and says you need to Kegel. No one says you need to think about it before you sneeze as a 3-year-old. That would be an interesting conversation. But what does a kid who's potty training look like? They are up and down, they're dancing, they're crawling, they're twisting, they're turning. What do we not do as adults? We don't move that way. So if you compare the movement of a 2-year-old and the movement of a 20, 30, 40, 50, 60-year-old, it's very different. Our lifestyles, again, pain issues, jobs, things like that, that, what we're able to do recreationally start to dictate how our bodies move. And when we do that, it starts to limit a lot of our motion.
So I know I've read that as Americans, we sit as much as an average of 10 hours a day, and then we go to bed.
It's a very fixed pelvis.
So what about women who might say, well, I run, but I still pee, and I exercise, but it's embarrassing when I leak, or it hurts when what can we, why is just running maybe not enough, or going for a walk at lunch? What needs to change about that?
Part of it is balance. So if you're sitting for 10 hours a day, but you run for an hour, you're still looking at the seesaw effect of you're still sitting on a fixed pelvis a lot more than a mobile pelvis. The other problem is that our movement patterns are dictated by the path of least resistance. So your body's going to find the path that kind of works for it, and it's going to stick with it. And so if there's some motions that are a little limited, or you have some flexibility issues, or you've had injuries, so you're a little guarded in certain directions, your body's going to find a path that works for it. And so even if you're active, most likely you're only active in certain directions or motions because that's where your body's comfortable.
Yep.
You still may avoid other certain planes of motion and other directions that your
Right.
body needs in order to stimulate these pelvic muscles.
So like that one of the things I tell my clients all the time, like people who have arthritic pain or things like that, is that yes, you are going out walking, but your hips are a ball and socket. They're three-dimensional, and so I tell them to think like if you drove your car on your lawn on the same path every day, you're going to wear a groove in it, and that's where your car's going to want to go.
Right.
And there's so much more space
Absolutely.
to move in. And so how does like knowing that your hips are, I hear you say like move your pelvis. So I think a lot of people, how do we do that? So the
Right.
hips are connected to the pelvis. So
Absolutely.
what are some things that you teach people how to do?
So it's multi-directional, exactly what you said. It's trying to repave that path that they're always on. So it's exercises, it's stretches that are multi-planar. So there's things that go forward and back. There's exercises that involve side bending or lateral motions. There's exercises that involve rotation. The most fascinating thing for me is that, again, a lot of us walk or we run or we do things in a very kind of sagittal, one direction kind of movement patterns.
Yeah.
And if you look at the pelvic bowl, the muscle that's the largest is the muscle that has fibers that run laterally or side to side. And I find that is the most restricted motion when I assess people functionally, is that their pelvis and hips
Absolutely.
don't want to move side to side. And that's the biggest part of the pelvic floor muscles. The orientation of the fibers is lateral compared to the vertical ones and the rotational ones. And so it makes sense that if you're not moving in this lateral direction, which could be sidestepping, side lunging, there's a variety of activities that will activate that group of muscles. But if you're not doing it, and it's not a natural movement for most people, it makes sense that part of the pelvic floor is not activating and then leads to problems with the pelvic floor.
And I think that how many people do you see maybe that are coming in to see, like we're both physical therapists, right? We both learned this approach about three-dimensional movement from the Gray Institute.
Yep.
Gary Gray's wonderful information about applied functional science, and we use it in sort of different ways.
Yep.
So like I see a lot of that problem with the side-to-side motion when anyone comes in to see me for back pain. Do you see a lot of women with back pain?
Yeah.
And this is a big correlation?
I would say that probably, I don't know exactly, but I always tell people probably 98 or 99% of every patient I see that has pelvic floor dysfunction has had either a history of back problems or back injury or chronic back pain, or an issue of, hip bursitis or hip pain or hip fractures or
How about those
tailbone
knees?
fractures. Exactly. I mean, there's always something that precedes it. So what I do find with the pelvic floor is that there's warning signs that your body's telling you that you're not moving well, and pelvic floor issues are just a symptom of another way that your body's trying to handle that lack of movement. And so it's not usually, for most people, the first thing that goes. They don't put that together until I start giving them the education piece and asking, what other injuries have gone on, or when you started experiencing this, what was happening in your life? A lot of them say, I was in a car accident and fractured my tailbone, and then within the next 6 months this started to happen with my pelvic, I started having incontinence symptoms. Like there's always a relationship between some other sort of injury or breakdown in the body that then leads to this domino effect.
So true. I mean, don't you find that like it's so surprising to me when I see clients coming in here at a Berkshire Fitness Company who have seen so many other people to try to help them with a bursitis or a shoulder pain or a movement related pain.
Yeah.
And nobody watches them move.
It's fascinating.
And nobody tells them what they can do to control it.
Right.
And to help themselves.
Absolutely. Or they look at it in isolation. The number of people who've seen doctors who they have back pain, so they only look at their back.
Wouldn't it be great if we all remembered that the hip bones connected to the
Exactly.
knee
It's
bones?
fascinating to me. Like, well, did they look at your hips? Did they look at your thoracic? Like, there's so many other pieces to the body, and I feel like our healthcare system often gets tunnel vision of
Big time tunnel vision.
one area of the body.
Yeah. So let's say someone has like finally gotten in to see you, and I know you, so I know you've taught some classes, and you've found that it's that education piece, but also the community.
Absolutely.
And what do you do all day long?
Work with women with pelvic issues all day long. And the biggest question I get is, am I the only one that you see that has this problem? And I'm always like, nope. But the biggest thing is there's such a stigma around this, and you can't talk about it at, you know, girls' night out like you can your back pain or your shoulder pain.
Well, you might, but you might all just laugh when it happens, and it's like,
just, it's not, there's just a stigma around it. And so women, I think, often keep it to themselves. I find that they don't even tell necessarily their partners or their spouses. And they feel very alone and very isolated, and it starts dictating their life in small ways that then start to turn into bigger ways that they don't even realize until it starts getting better.
How?
So women who tell me that they've stopped going out places unless it's someplace they've been before where they know where the bathroom is.
Or the urgency.
The frequency, worrying that they're going to leak in public. They've stopped having sex because of pain. They've stopped, it just starts affecting their social life. They stopped exercising because of incontinence. They won't run outside in the yard with their kids. They won't go to the trampoline park with their kids because they're afraid they're going to leak. It really starts taking over multiple pieces of their life, and I don't know that they even realize it until we're able to give them back some of that.
Yep.
And